The knuckles of your fingers, the nape of your neck, your armpits. Most people have never been instructed to observe these areas for any medical purpose. It's easy to ignore them, but for millions of people, these same locations already show the first visible signs of a condition that precedes type 2 diabetes by years. The 5 signs below are visible, and once you know what you're seeing, you'll never be able to ignore them again. Sign 1. Tingling or numbness in the hands and feet. This is the sign that should stop you cold, because it means the damage has already begun. Most people who experience tingling or numbness in their hands and feet assume it's positional. They slept on their arm wrong. They sat too long with their legs crossed. They wait a few seconds, shake it out, and move on. But there is a specific type of tingling that has nothing to do with pressure or position. It shows up randomly. It can feel like pins and needles, a faint buzzing, or a subtle loss of sensation at the fingertips or the soles of the feet. It comes and goes, and it doesn't fully resolve the way positional numbness does. This is early peripheral neuropathy. In the context of prediabetes, it means elevated blood glucose has begun to damage the small nerve fibers that run through the extremities. The mechanism, glucose, at chronically elevated levels, is toxic to nerve tissue. It impairs the blood vessels that supply oxygen and nutrients to the nerves, the vasa nervorum. When those tiny vessels are compromised, the nerves they feed begin to malfunction. The earliest signal is sensory, tingling, numbness, or a faint burning sensation, starting at the tips of the toes and fingers and gradually moving inward. What makes this sign so critical is the timing. Nerve damage from blood sugar elevation can begin before glucose levels are high enough to meet the clinical threshold for diabetes, which means if you're experiencing this and ruling out other obvious causes, your blood sugar may already be doing damage at levels your last routine checkup called normal. This is not something to wait on. Now, the second sign is the dark spots around the knuckles. There is a specific change on the hands that many people see every day without realizing what it actually means. It tends to appear first over the knuckles, leaving the skin darker, thicker, or with a different texture than the rest of the hand. In many people with prediabetes, the skin over the knuckles develops a distinctly darker tone, not a bruise. The discoloration is diffuse, not localized to one spot, not a stain. It doesn't wash off, and it tends to be slightly thicker than the surrounding skin, sometimes with a texture that feels rougher or more pronounced than it should. This is acanthosis nigricans, the same condition that appears on the neck and underarms, but presenting in a location almost no one thinks to check. The cause is elevated insulin acting on skin cell receptors it wasn't designed to target. When insulin is chronically high, it binds to IGF-1 receptors in the skin and triggers abnormal proliferation of keratinocytes, the cells that make up the outer layer of skin. In areas of natural friction and skin folding, like the knuckles, this proliferation concentrates and darkens the skin. What makes the knuckles significant as a location is precisely how overlooked they are. Most people know to check the neck. Very few know to look at their hands. And yet this is one of the places where the signal appears early and clearly for anyone who knows what they're looking at. Sign 3. Dark, velvety skin on the neck or underarms. You've probably seen this described before as a skin condition. Something to treat with the right cream, the right exfoliant, the right routine. And dermatologists will often address it exactly that way, focusing on the skin itself, not on what's driving it from the inside. But when the skin on the back of your neck, the sides of your neck, or deep in your underarms develops a darker, slightly velvety appearance, thicker than the surrounding skin, with a texture that almost looks like it has depth, that is not a surface problem. It's the same mechanism as the knuckles. Elevated insulin overstimulating skin cell growth in areas where skin folds naturally. The difference is location. And location matters because the neck and underarms tend to show this change earlier and more visibly than almost anywhere else on the body. The velvety texture is the detail most people miss. It's not just darker, it's different in texture. Run a finger across it and compare it to the skin an inch away. The affected area feels softer in a particular way, almost like suede. That texture comes from the thickening and folding of the outermost skin layers as cells proliferate faster than they shed. And unlike a tan, this doesn't fade with time. In fact, without addressing the underlying blood sugar and insulin levels, it deepens. Slowly, consistently. A visible record of what's been happening metabolically, written directly onto your skin. Sign 4, tiny skin tags, suddenly appearing around the neck. 1 is nothing. 2 is a coincidence. But if you've been noticing small, soft growths appearing around your neck, on the sides, the back, near the collar line, clustering in a way that feels like it's accelerating, that pattern is a signal worth taking seriously. Skin tags are benign. They don't hurt. They don't become cancerous. And in isolation, they're common enough that most doctors won't flag them. But the research connecting multiple skin tags to insulin resistance and prediabetes is consistent and well documented. The mechanism is the same one driving the skin darkening, excess insulin, overstimulating the growth of skin cells, and fibroblasts, the connective tissue cells that build the stalk of a skin tag. The neck is a primary site because it's an area of frequent movement and friction which concentrates the effect. What matters here is not the presence of skin tags, it's the pattern. Sudden appearance, multiple tags, clustering in the same area, growing faster than they used to. These are the features that shift a skin tag from cosmetic nuisance to metabolic signal. If you've been removing them and watching them come back, that recurrence is telling you something. You're treating the output while the input, elevated insulin, elevated glucose, continues unchecked. Sign 5, a dark horizontal line forming. Across the neck clothing, or even dirt. It tends to appear gradually, running across the front of the neck as a horizontal band, slightly darker than the surrounding skin, and precisely because it comes on slowly, most people simply get used to it, never realizing that it shouldn't be there at all. This is a distinct presentation of acanthosis nigricans, one that forms specifically in the skin fold that develops when the neck bends slightly forward, which is essentially all day for most people. The constant, low-level friction of that natural crease, combined with elevated insulin overstimulating skin cell growth, produces a line rather than a diffuse patch. What makes this sign so telling is how specific it is. Acanthosis nigricans in general has multiple potential causes, not all of them metabolic, but this horizontal banding pattern, forming specifically across the neck in a person who is otherwise healthy, has a very strong association with insulin and glucose dysregulation. People who have it often assume it's a shadow or a line from a necklace or something that will wash off. They've been living with it for so long, it's become part of what they think their neck simply looks like. It isn't, and unlike a shadow, it doesn't disappear when the light changes. 5 signs, all visible on the surface of the body and all connected to the same silent problem. Blood sugar and insulin levels staying elevated for too long. But here's the important part. Prediabetes is still a warning window, not irreversible damage. And the 3 methods you're about to see aren't random internet tips. They work directly on the mechanisms that make glucose rise in the first place. Simple changes. But when applied consistently, the impact on blood sugar levels can be far greater than most people expect. Method 3. Consider berberine. This one is last because it requires the most context and deserves it. Berberine is a compound extracted from several plants, including barberry and golden seal. It has been used in traditional Chinese and Ayurvedic medicine for centuries, but what brought it into serious scientific attention is what happened when researchers began comparing it directly to pharmaceutical interventions for blood sugar control. Multiple clinical trials, including randomized controlled studies published in peer-reviewed journals, have found that berberine produces reductions in fasting blood glucose, post-meal blood glucose, and HbA1c, comparable to metformin, one of the most commonly prescribed medications for type 2 diabetes and prediabetes. The mechanism operates through a pathway called AMPK, AMP-activated protein kinase. AMPK is essentially a cellular energy sensor. When activated, it improves glucose uptake in muscle cells, reduces glucose production in the liver, and enhances insulin sensitivity at the receptor level. Berberine is one of the most potent natural activators of this pathway known. A typical study dose is 500 milligrams taken 2 to 3 times per day with meals. Timing that matters because berberine works in part by blunting the post-meal glucose response. 2 important notes. First, berberine interacts with several medications, including those for blood pressure and blood thinning. If you're on any medication, consult a physician before starting. Second, because its effects on blood sugar are real and measurable, it should be treated with the same respect as a pharmaceutical, not as a casual supplement. This is not a magic pill, but in the context of prediabetes, where the window for reversal is open and lifestyle interventions are the primary tool, berberine is one of the most evidence-backed additions available and one of the least talked about.